Right, have anybody got any questions before we start?
No.
Right, okay, well, so we'll start with the presentation for today then. As I said before, it's about understanding public health and health promotion today. So we're going to look at the indicative content. These are all the things that we're going to be looking at. I'll just read them through for you and I'll explain a little bit as we go along. The theoretical frameworks informing public health and health promotion. So we're going to be looking at examples of health behaviour models. Some examples of these are social cognitive theory, the trans-theoretical model, which...
Sorry, we can't see that.
Can you not see it?
No,
Right.
it's only context that we are seeing.
Yeah, we see the other 0.3 and 0.4.
Yeah, but 0.3 and 4. That's all we can
Right, so
see.
you need to see my presentation, don't you? Just thanks for stopping me. Let me get you back onto the screen. Right, can you see my presentation now?
No, it's not showing.
It's still not showing. Right,
No.
just bear with me. Bear with me. Everything on my screen is saying I'm sharing it with you, but I don't know why it's not coming up. You still can't see it?
No.
Very good. What I can say is understand public health and health promotion. That's 0.3.
You can see that?
Yeah, that is understand public health and health promotion. And the
Right, so
context is
that's my presentation. That's the first slide of my presentation. Can you see this one now, the second one? Can you see that?
No, it's just the
Indicative
context.
content.
It's just the context that we are seeing. The context 3 and 4.
Right, so you're still seeing that one, right? Bear with me. I don't understand why it's not sharing the thing with you. Right, just bear with me. Right, can you see it now?
Yeah.
Right,
yes.
Good. At least we're there now. We're not going to wait much longer. Right, thank you for your patience with that one. I don't know what happened there. Right, so we're looking at understanding public health and health promotion. Let me just move this one out of the way. You can still see it, yes?
Yeah.
Right. The indicative content. What that means is that these are the things that we're going to be talking about today. It's just a word that means that we're going to be looking at these. So we're going to look at theoretical frameworks. It's important that you look at these, especially when you're doing your assignment. So theoretical frameworks, they inform public health and health promotions. And we've got different models. We've got health behavioural models called, examples are social cognitive theory, trans-theoretical model or stages of change, health belief model, and the theory of planned behaviour. So we're going to look at those in particular today. We're going to look at politics and policy for public health globally and in country of choice, which, as you can remember from last week, is the USA, effectiveness of policies, public health epidemiology and statistics, public health promotion and the importance of this, the preventative impact that promotions do have, protection and improvement of health. We're going to look at communication of public health messages, how messages are given out to people, how they're communicated and how effective they all are. We'll look at current major health issues, for example, epidemics and pandemics. That can also include obesity, which is a worldwide problem. We'll look at how health issues are addressed. by health promotion, the legislation, for example, smoking, stopping smoking. You know, we have to put different labels on food now, so you know exactly what you're eating. It also tells you if you're allergic to different things. There's vaccination programs, the effects and benefits of having all these. Now, I put some key terminology on there that you'll probably come across these within these slides. So it's just to give you an example of what some of them are. You probably know some of them anyway, but I just thought I'd mention them. Right, social cognitive theory, that's the influence of individual experience. It's the actions of others and the environment on health behaviour. So it's how people respond to it within the society. The trans-theoretical model, or stages of change, that's the idea that people go through 6 different stages of change before they actually make that permanent change. And also, different theories can be applied to every stage on that model. There's a health belief model, and that's the idea that people will change their behaviours based on how serious they think that their illness is. So if they're really serious about their health problems, then that's the health belief model that they will follow. There's a theory of planned behaviour, and that's the idea that behaviour is determined by different beliefs about that behaviour. And it's about how attitudes and beliefs of other people towards that behaviour influence people as well. I put public health epidemiology on there, and that's all concerning research. And research is conducted to establish the different factors that lead to public health issues. A multifaceted approach is used later on in the slides, and that just means using many methods or sources of information to gather information. It's using as many different things to get your information together, or different people you can go to. NCD is the non-communicable diseases. Those are things that you don't pass on. People can't catch them. They've actually come within. So we've got things like cancer, heart disease, diabetes. Any questions up to now?
Oh.
Are you all with me so far?
Yeah.
Okay. Now then, there's another page I put down for key terminology as well. There's a phrase called compliance fatigue. And that is when people who work in a professional capacity, their physical and mental health abilities are impacted by the actual size and the nature of what they're doing. They're expected to perform under really, really hard conditions, and sometimes they just have burnout. A herd immunity, that's something that Boris Johnson always used to talk about in this country when he was talking about COVID. And the herd immunity is the protection given to a population against the outbreak of a particular disease due to high numbers already being immune by either being vaccinated or they've already been previously infected by it before, so they have that immunity there. I did mention the Ottawa Charter. Now, the Ottawa Charter is really important. This was the first health promotion, and it was held in Ottawa in 1986, and it was put on by WHO, the World Health Authority. The Charter is seen as a global milestone and is still a vital reference for health promotion today. It's got 5 strategies: developing personal skills, having a supportive environment, being able to strengthen communities, to build a healthy public policy, and reorient health services. Reorient health services just means to move away from the clinical side and look at all the different aspects that they have relating to health. I put COVAX down there, and COVAX was related to the COVID-19 vaccines global access. And the last one I did was the mental health parity laws. In the United States, this prevents health plans from putting barriers on people accessing mental health benefits. Remember, because in the United States, everything's all about having access to insurance, being able to get benefits for health. Now then, I put 2 videos on here. One explains about public health and the other one looks at health promotion. I think for today, we'll just look at the public health one, and then you can look at the promotion one later on. I'm only saying that because they last about 5 to 7 minutes. Are you okay to watch the video?
Yeah.
Yeah.
Right, okay, let's just go ahead and see if I can put this one up. Now then, you tell me if you can see my screen when I put it up. Can you see that? Let's
It's
Learn
not
Public Health, the YouTube.
No, it's not showing yet.
It's not showing, right? Bear with me
No.
while I check to see where it is. I know it's on here somewhere. I just want to make sure I share it with you. Oops, it's already started. Can you see it? Oops, keep clicking off it. Can you see it now?
No, it's not showing.
It's still not showing.
No.
I don't know why it's not on my screen. It keeps telling me that I'm sharing everything with you. Just bear with me. Can you see that one now? Can you see the YouTube
Yeah.
page?
Yeah.
Yeah? All right, good. We got there in the end. Oh, sorry about that.
Or infirmity. Pretty bold and ambitious definition that causes people to look beyond diseases and focus not only on the physical aspects of health, but also on the mental and social aspects as well. And disease, prolonging life, and promoting health through the organized efforts of society. Okay, so how is it different to clinical medicine? Let's take a look at accident and how to work in life. Clinicians' main focus is the immediate health problem, fixing the fractured leg. Clinicians focus on the would be holistic and would focus on figuring out how and why this person had an accident. Again, for example, why did he have the accident? But he not afford it. That's not right. As you can see from this example, health is determined by itself. These include individual characteristics, lifestyle, and behaviors, and also in order to make a difference in health, there's action needed across all the different determinants. Make changes that benefit the health health of the population as a whole. This seems like a very broad and complex task, doesn't it? So, who's responsible for public health? Ultimately, the responsibility of creating a healthy community. You have a central role in public health. However, improving the health of a population requires the coordinated efforts of a broad range of stakeholders. Areas of public health are protection, promotion, and prevention. Protection is about protecting the health of the population. This includes the control of infectious diseases, ensuring the health of workplace, and health emergencies. Prevention is about improving the health of the population. It covers a broad range of activities that focuses on the individual, like promoting health behaviors over life. Social determinants of health. Prevention is about preventing health issues before they occur. It includes activities such as vaccination and screening. To enable these core areas to function, there needs to be good governance. Such as relevant research. So that's a quick introduction to the fascinating field of
I think that really does give you a good example. What do you think?
Yeah, it's a good example. Yeah.
I know it's a bit longer than some of the videos we normally show, but and if you go on YouTube, there's things on there that you can watch for hours and hours and hours on end. But it's just that you have to have the time to do that. But there's lots of information on YouTube if you need it. Now, can you see my screen? Back to
Still
the
YouTube.
presentation.
No, still YouTube.
So you still can't see it?
It's still on YouTube.
Right, okay. Right, just bear with me.
All right.
I must be doing something. On my screen, it's showing I'm showing everything, but obviously I'm not doing. Bear with me while I go through everything to do it.
Okay.
Right, can you see that now? Can you see the presentation now?
Yes.
3.1, analyze the concepts of public health and health promotion in national context. Yeah?
Yeah. Yeah.
Yeah.
All right,
Yeah.
good. Right, in analysing the concepts of public health and health promotion within the national context, and don't forget we're using the United States, it's essential to examine how these concepts are understood and applied within the different countries. Like what we do here is going to be different than what we do in the United States, as well as lots of other countries as well. They all have their own different ways of doing things. So for the sake of the whole of this context, for the whole of the assignment that you're going to be covering, it's all going to be based on the United States.
Okay.
Right, so when we look at public health, now the definition given here for public health is it focuses on protecting and improving the health of communities and populations using preventative measures. That means it's like it tries to stop them before they actually start. It looks at health education, so improving people's knowledge and education around health, policy interventions, and disease surveillance. Disease surveillance means that they're always watching. Research is being carried out all the time to watch the way different diseases progress. Right, key components of this, we've got disease prevention and control. So public health agencies, they work to prevent the spread of infectious diseases, such as they use vaccination programs and disease surveillance. The health promotion is promoting healthy behaviours and lifestyles, such as stopping smoking and different programs around stopping smoking. And I know that one of the good examples here that you could use, you know, when we were talking before about some of the theory models, a good way of using one of the theory models for stopping smoking is the trans-theoretical model, or the stages of change, which uses 6 changes. And when you talk about smoking, smoking is one of the behaviours that's very, very difficult for people to stop. And if you look at the different 6 stages, you've got the pre-contemplation stage. Now, pre-contemplation means that you're not thinking about having a problem. It's before you start to think about a problem. People can be telling you you've got a problem, but you're thinking, I'm all right, I haven't got a problem, I'm fine. Now, from the pre-contemplation stage, they go to contemplation. And contemplation is when you start thinking about, well, maybe I have got a problem. I'm not sure what it is, but maybe I need to look at it. Once you start having that idea in your head, then you start to look at what you can do to start changing behaviour. So you look at preparing to follow a different path. What can you do to make things different? And then once you've got that under control, then you start going into action. So you're stopping smoking. You're okay, I'm doing okay. Then you go into long-term maintenance. But the sixth aspect there is relapse, and relapse can happen at any stage. It can start from when you first start thinking about it all the way through to maintenance, and you can go in and out of relapse a few times before you actually make that permanent change. But that's one model you can talk about, especially when it's associated with stopping smoking. It's just a good example, sorry, going on with myself there. They can look at different things about nutrition education and different physical activity initiatives, you know, to get people moving. Sometimes they do things like park runs, you know, to get like big communities to move together. These all are core components of public health efforts. So there's lots of things in place to try and get people to change behaviour, and it's all to do with health promotion. Environmental health is a big factor, and monitoring and addressing environmental hazards, they can also impact on people's health, looking at things like air, you know, and water pollution. And there's been lots of things on the news about soldiers being impacted by, you know, like being exposed to different air and water supplies, and it's given them cancer and things like that. All these things are put in place to protect public health and reduce the health disparities. The health disparities are all about making sure that people have equal access for everything. Health policies, advocating for policies and regulations that promote health equality, access to healthcare for people, and the social determinants of health. And remember, we were talking about the social determinants of health last week. The social determinant of health, just like it said on the slide from YouTube, they're all the non-medical factors that influence people's health and lead to stress, which can be finances. They might have very, very little money and they're wondering where, you know, they can get more money from. Education could be lacking. People that even may struggle for reading and writing, or they could have a language problem. There could be unemployment issues. Housing issues, they might live in really poor housing, or maybe no housing at all. They might be living, you know, like sharing from, you know, like a sofa from house to house, or, you know, staying with people from one week to the next. Environmental issues really do lead to stress. It could be social support and people's lack of social support, isolation for people. The social determinants of health are everything apart from a person's actual health. So it's important that when you're doing your assignment, that you do look at mentioning, you know, like the social determinants of health. The government agencies, now they've got public health in the United States, is primarily managed by the federal, the state and the local government agencies. They've got the Centre for Diseases Control and Prevention, that's known as the CDC. They've got the Food and Drug Administration, which is the FDA, and different state health departments. They've also got another Department of Health and Human Services, and they've actually got an initiative underway at the moment, which is called the Healthy People 2030 initiative. And that's looking at improving people's health literacy. And we did mention health literacy last week. And don't forget, it's the ability for people to find information, understand how to use it, and how to understand how to use the services that are available to make health-related decisions, for people to do it for themselves, and also for them to give advice to other people or different family members. Any questions up to now? Are you with me so far?
Yeah, we are with you.
Okay, good. Right, health promotion, and the definition that we've got here for health promotion is that it focuses on empowering people and communities for them to take control of their health and well-being. So empowering people is very important, because if you don't empower people, people will always rely on somebody else to do things for them. So it's really important that people take on that control for themselves. It addresses the underlying determinants of health and promoting healthy behaviours. So health promotion and how that's put forward to the people is really important for them to be able to access it and do something with it. Now, key components of that, we've got education and awareness, providing information and resources to empower people to make their informed decisions about their health. These health literacy programs are really important, you know, for people to be able to learn how to access the health, you know, like services that they need. And community and health education campaigns are also big at the moment. Now, don't forget, America is a huge area, you know, crossing from north, south, east and west. It's a huge area with lots of different peoples there. So it's important that all these different community groups and literacy programs cover all aspects. Now, behaviour change interventions, implementing strategies to encourage people to have healthy behaviours, such as stopping smoking and starting physical activity, getting more involved in moving around, and also healthy eating campaigns. They're all really, really important, because without them, people's health can really suffer. Don't forget, smoking is associated with so many different kinds of cancers. Physical activity, if people can keep moving for as long as they can, it will really improve their mental health and well-being. It's one of those things that if you don't move, then you lose your muscle mass, and when your muscles become weak, and then you think, oh, I can't move anymore, I can't walk anymore. But sometimes inactivity will force you to not move anymore. Healthy eating campaigns are really important as well, because obesity is a huge problem. Creating supportive environments, that's an important component, because promoting environments that facilitate healthy choices, such as workplace wellness programs. I mean, lots of companies now, they have different programs in place where you can access counselling and different kinds of help with your physical and mental health. Safe neighbourhoods for physical activity. So if you're going to start walking around, or even going running or cycling, then you need to feel safe in the area where you live. Otherwise, you're not going to do it, because you're going to be scared to go out. So it's important to have safe neighbourhoods. And accessing healthy food options. Sometimes that can be because the healthier food options can be more expensive than the cheaper ones that are not as healthy. So it's important that people are able to get these healthy food options. There's no point telling people to eat more healthily if they can't afford to buy them. Community engagement is a huge one. Health promotion efforts in the United States often involve collaboration with community organisations. They're involved with healthcare providers, schools to promote education, and different stakeholders. And stakeholders, those are all the other people who have got a vested interest in what's going on. Those can be patients, or it can be the general public wanting to know more. Also, it's different organisations who might be putting money into different things. These are all important to address local health needs and the priorities, because priorities in one area might be a different priority to somewhere else. Now then, in the United States, public health and health promotion efforts, don't forget this is the one that we're concentrating on. The health promotion efforts are multifaceted. That means that there's so many different aspects of them. You're not just looking at one thing, there's so many things involved in it. And these involve collaboration between government agencies, healthcare providers, community organisations, and individuals. It's involving everybody. While significant progress has been made in addressing public health challenges, such as people stopping smoking or reducing their smoking rates, and improving people getting their vaccinations, persistent health disparities and emerging health threats continue to present challenges. So although they've got certain things in place, there are huge problems with other things that they've not even touched on yet. Effective public health and health promotion initiatives require a really, really comprehensive approach, and they need to address all those disparities. Do you remember we're talking about the social determinants of health here? We've got social problems, economic problems, and the environmental problems. These are all determinants of health. They promote health equity and engaging communities in decision-making processes. So there's a huge problem there, and it's important to bring all the different agencies and people from different backgrounds together. So in conclusion to this part, analysing the concepts of public health and health promotion within the United States provides insights into the different strategies, the different challenges and the opportunities for improving population health and well-being. It's important that you mention the different ones as well. By understanding the unique context and needs of each country, the policymakers, the people who make all these policies, the healthcare providers, and the different communities can develop tailored interventions for that particular area that address the underlying determinants of health and promote equal access to healthcare and resources for everybody. Any questions on that one?
No.
No, you're okay so far?
Yeah.
Okay. Now we'll look at the merit. Now, when you're coming to do your assignment and you want to get more than a pass, you want to look at getting a merit. This is one of the things that you can bring in. So this says, assess, I can't speak this morning, assess how current major healthcare issues in national and/or worldwide context are being addressed. In assessing how current major healthcare issues are being addressed, it's crucial to examine both the national and the global efforts. So we're looking at what's going on in the US, and then we're looking at what's happening worldwide, what the efforts are to tackle these challenges. So let's explore some key healthcare issues and the corresponding responses. Now, when we're talking about pandemic, we've got to mention the COVID-19 pandemic. So we're looking at the national response, for example, in the United States. Now, they implemented public health measures such as mask mandates. That's people were made to wear masks. Everybody had to wear a mask if they were going somewhere or if they were in contact with people. There was social distancing. Remember the social distancing? You had to keep so many meters away from each other. And the vaccination campaigns, people queuing up to get their vaccines. The national response was to expand testing and contact tracing capabilities. Do you remember the thing here that we used to do about the tracing? So if you were in contact with somebody, you had to test yourself. And then you had to report it here to the NHS. Well, they had a similar thing going on in America as well. And they were looking at the ability to identify and isolate different cases to make sure that people stayed safe. Deployment of emergency funding to support healthcare systems. So money was put in place to support healthcare. There was research into, the vaccines and what else could be done, and the vaccine development. And if you remember that the vaccines were developed very quickly. I mean, normally when a vaccine's developed, it's brought in, they usually take a few years because they've got to test it on people, before they can put it out to the general population. But the vaccines were developed very, very quickly for COVID-19. And there was a collaboration between the federal, state and local governments, healthcare providers and community organisations to coordinate the response efforts. Remember, it was like the government give out the information, and healthcare providers and the public have all got to get together to get immunised and to keep safe. Now, when you look at the world response in that same situation, there was a formation of global partnerships such as COVAX. And COVAX was put into place to make sure that people were given equal access to the different medicines that were available, to the different vaccines, to ensure equitable access to vaccines for low and middle income countries. So COVAX was put there to make sure that countries were able to get together and to give what they didn't need to other countries, to make sure everybody had access to it. Well, the United States was one of the countries that didn't join in with this, because it was the Trump administration at the time, and he decided he didn't want to be part of this. But what they did do, they donated, I think it was something like 4 billion to organisations to make sure that vaccines were available to people in different countries, but they didn't want to be part of the COVAX campaign. And the global response was to share resources and expertise, and also the scientific knowledge through different platforms. And the World Health Organization, they were on the news more or less daily, talking about different things that, research was being done all the time. And the Global Outbreak Alert and Response Network, that was another agency at the time. There was advocacy for vaccine equity, including calls for patient waivers. A patient waiver is where, because it was such a new vaccine, people were asked to say that they wouldn't, if anything happened to them, they wouldn't start to sue or anything like that. It was just to get people vaccinated as quickly as possible. And the patient waiver was just saying to people, just be vaccinated to keep safe. We know this is going to keep you safe. So just, even though it's not taken years to develop, please have the vaccine to keep safe. Technology transfers were shared all the time to increase vaccine production capacity within developing countries, because the developing countries did not have access to the different vaccines. So they needed the help from the rest of the world to do that. There was support for strengthening the healthcare system in vulnerable regions to prepare for future pandemics. And it's like they've had different things going on. And I know in England they had one just recently where they examined what the government did in relation to COVID-19. And it was seen that there was nothing in place to prepare anybody for a pandemic. And it was the same in the United States. Nobody was prepared for this because nothing had been seen on this level for such a long time. People just didn't think it was going to happen. So they've learned now that actually things could happen. So they put things in place that in future, if anything was to happen, it wouldn't take them as long to get together to put something in place to protect people. Now, the mental health crises. People's mental health suffered, especially during the COVID-19 thing, especially when they were isolated. And a national response to the mental health crisis was to expand mental health services and the telehealth options to improve access to care. The telehealth option was for people who were in, because of the geographical area in the United States, people in places where they were so far away from different communities, or the communities were spread so fast and wide, that it was decided that if they put something in place, like we're doing now, we're accessing, you know, the lesson over the internet. It's like putting things in place so that people didn't actually physically go somewhere to get help. They could actually access it through the internet or the telephone. The integration of mental health screening and treatment into primary care settings was put in place to address stigma and facilitate early intervention. Now, stigma has always been a huge thing with mental health. People never wanted to admit that they had a mental health problem, in case people thought that, you know, there was something, you know, really wrong with them and they weren't fit to be out in the community on their own or with anybody else. And it's taken a long, long time for the stigma to be broken down, but it still exists in a lot of areas, especially in hard to reach areas. The implementation of community-based interventions, peer support programs, the support that you can get from person to person cannot be undervalued. It's so important that you get support. People who are isolated just suffer because they start to think about things. They start to think and manifest on different things because there's nobody to actually tell them that their thoughts might be wrong or anything. So peer support is very, very important. Crisis hotlines are also important. And all these provide support for individuals who are in distress. Advocacy for mental health parity laws to ensure equitable coverage for mental health services by insurance providers. But don't forget, in America, everything's all about having insurance. So the health parity laws ensure that people with mental health issues are not penalised with their health insurance, and they can access support for their mental health many times. Now, the global response to mental health, there's a prioritisation of mental health in global health agendas. It's gone from being something that people very rarely talked about to being really high on the agenda now. And the World Health Organization have a mental health action plan, which they share with the rest of the world. There needs to be collaboration between governments addressing mental health, different international organisations and non-governmental organisations come together to address mental health needs using a humanitarian setting and conflict-affected regions. Humanitarian settings about looking at people and their personalised, you know, person-centred care. And conflict-affected regions, especially in war-torn areas. I mean, there's different examples going on in the world at the moment. And the mental health of people suffering when they're seeing people being blown up next to them must be unbelievable. I can't even put that into words, really, how people are affected by that. The global response is to have research initiatives to better understand the impact of social, economic and environmental factors on mental health. Research cannot be underestimated either. There are different people, different organisations who just continue to research day after day after day in order to find different ways of working out things. All these are important on mental health and to inform evidence-based interventions, because evidence-based interventions means that they've been proven to work, and they can always say, well, according to this works. Promotion of mental health literacy and how people can access understanding and services, and awareness campaigns to reduce stigma and discrimination associated with mental health. Because the stigma is huge. And sometimes they always used to say that men used to struggle more with their mental health than women. And one of the reasons they used to say that women found it easier to deal with mental health because women had the ability to cry, and women were encouraged to cry, which helped to release some of the stress. Whereas men were like brought up to be, well, you're a man, you have to get on with this. You know, you can't cry, you can't be sad, you just have to get on with it. And that's what they used to do with people in the armed forces as well. It's like, well, you're a soldier, you know, You know, you need to be able, you're going to see things, but you're going to be able to cope with everything on a day-to-day basis. You don't have to think about your mental health. So all those stigmas associated with mental health and the discrimination around it, because different societies as well will discriminate against people who are seen to have mental health problems. So there's lots of things being put in place globally and nationally for mental health. Now, another one there is the non-communicable diseases, the NCDs. These are the ones that you don't pass on. These are the things that you can't get infected by them. This is something that you develop within yourself. And the national response is to implement policies and programs to prevent and manage the NCDs, including, you know, like controlling tobacco measures and helping people to stop smoking, putting healthy eating initiatives in place, and also, again, the physical activity promotions. So it's all about trying to get people to be more healthy so they can avoid things like cancers, heart disease, obesity, diabetes. Integration of the NCD prevention and management into primary healthcare services through screening, early detection and treatment. So it's important that if people have got these diseases, that they're recognised early on, because the sooner, like with cancer, the sooner you can have it diagnosed, the sooner it can be dealt with and hopefully cured. Collaboration between healthcare providers, public health agencies and community organisation to address the social determinants of health. Don't forget, these are all the things that are associated with people not being well other than illness. So it's all the things that to do with the things that cause stress, like finances, housing, your environment, all the different things that contribute to NCDs, such as poverty and inequality. Because poverty is a huge thing, because you can't afford to buy healthy food. A lot of people, you know, who suffer from poverty, even though tobacco is really expensive, they still continue to smoke because they say it helps them to deal with stress. And you find that more people from a poor background will smoke, you know, and it's just because they feel that it's helping them, even though it's creating more problems down the line. So that promotion there is really important for them. Advocacy for policies to reduce risk factors for the non-communicable diseases, such as sugar taxes. Don't forget, a lot of the things as well, they have such a high amount of sugar in them that if people haven't got, you know, type 1 diabetes that's insulin based, with their diet, they can develop type 2 diabetes because they're eating a lot of sugar. And there's such a lot of hidden sugar within foods. Advertising restrictions need to be put in place, and urban planning strategies to promote active living. So it's all about promoting that healthier lifestyle. The global response to this is the development of global action plans, such as the WHO's Global Action Plan for the Prevention and Control of NCDs, to coordinate international efforts to address them. Support for research and innovation in the diseases, prevention and treatment, including the development of affordable and accessible medications. Sometimes medication can be so expensive, and people from a lot of the underdeveloped countries just do not get access to them. Collaboration between governments, international organisation and civil society to implement multi-sectoral approaches to NCD prevention. Multi-sectoral means that it's to do with people from so many different backgrounds, so many different organisations, including partnerships with the private sector, academia and the media. Don't forget academia, that's where most of the research goes on. So it's important in that the private sector and the research and the media all collaborate together, because the media are the ones who can sometimes, you know, like false news can get out, you know, and it's like, that's the kind of thing that stops people from getting vaccinations because they're not sure and they hear all these bad things that happen to people. and it stops them from, from accessing vaccinations. So it's important that the media get on board and they give out the right information for people. Advocacy for international agreements and frameworks, such as the Framework Convention on Tobacco Control, to address the disease risk factors at a huge global level. So everything needs to be tackled on a global scale. So the conclusion for this part is current major healthcare issues, whether at national or global levels, require a multifaceted response. So that means that collaboration between governments, healthcare providers, civil society, and international organisations must get together. Nobody can work alone and not share anything. It's about people finding out information and sharing it across countries, across organisations, so everybody knows what's going on. By addressing these challenges through evidence-based strategies, don't forget these are the ones where research has proven that they exist and that they work, policy initiatives and community engagement, we can work towards building healthier and more resilient societies. Continued investment in public health infrastructure, healthcare systems and research is essential. Money needs to be put in there, because without the finances to do that, we're not going to do anything. It's essential to effectively address these issues and promote health and well-being for everyone, regardless of their circumstances, that everybody needs access to these to have a healthier and better life. Any questions on that part?
No. Okay.
You're all with me. You're all with
Yeah.
me.
Yeah.
Okay. Now, again, this is a merit. This is another thing to look at for when you're doing the merit part of your assignment. And it's about evaluating the response to one current national or worldwide public health issue. And don't forget, we're focusing on the USA. So a response evaluation, coordination and collaboration. Now, the strengths, we're going to look at the strengths and weaknesses of these. So the strengths are the global response to COVID-19 has seen unprecedented levels of coordination and collaboration between countries. It's about countries have been getting together and sharing information on a scale that they've never seen before. International organisation, healthcare providers and research institutions and initiatives such as COVAX have facilitated equal access to vaccines, and information sharing has allowed for rapid dissemination of best practices and scientific knowledge. So the strength is that the collaboration of all the countries together during the COVID-19 has been able to share and give people more equal access to get their vaccines and to find best practices. And the scientific knowledge from the different countries has also been shared. So everybody now is more aware about how to deal with the pandemic. When you get the strengths, you also have weaknesses. And the weaknesses are, despite global efforts, coordination challenges have arisen due to disparities in resources. So when you've got different things going on within the country, you're never going to get what you should have. So you can write it on paper, it says, yeah, we do this and this and this, but in reality, things are very different. So there've been disparities in resources, political tensions, don't forget in the war-torn areas as well. And it's like, like things get dropped down, from helicopters and planes for people to access, but if the government don't allow the people to get access to them, they can't have them. Competing interests are also a thing, because different governments might want to produce something that they don't want to share with somebody else. So you're going to have that competition. Do we share or don't we share? In some cases, vaccine distribution has been unequal, with high-income countries securing more doses than low and middle-income countries. And the idea being at first was that the people who had lots and lots of vaccines could then share them with other countries. But in some cases, that didn't happen. Additionally, misinformation, people being given the wrong information, and vaccine hesitancy. Not everybody was going to queue up and get the vaccine because so many people were scared. I mean, with different religions, they were told that the vaccines were made up of certain animals, that it was against their religion to have anything to do with. And that used to put people off. And some people, they hear, the vaccine is going to make you paralyzed. It's going to make you sick. It's going to make your mental health issues worse. It's going to kill you. The vaccine hesitancy was huge in some parts of the, of the world. And it was distressing to see people refusing to have the vaccine because the information that they had just wasn't the right information. But it's that promotion to the different communities is so important. All those different things hindered efforts to control the spread of the virus. And so especially at first, it's like, it was just out of hand and people were catching COVID because they didn't understand or they didn't have access to the vaccinations. Now, public health measures, the strength of public health measures, such as mask mandates. The mandate is it's like a law. People have to wear a mask. So people used to have to wear the masks when they were in contact with other people. Social distancing guidelines. People had to adhere to the social distancing, keep so many meters apart. And the lockdowns, people were not allowed to go out after certain times. It's like, and people were restricted to stay within certain areas. They've all been effective in slowing down the spread of the virus and reducing the transmission of the virus from one person to another in different regions. The mass testing and contact tracing efforts help to identify and isolate cases, preventing further outbreaks. So when people did catch COVID, if they reported it to the authorities, it was mentioned, and then other people were contacted if they'd been in that certain person's immediate environment, so that they could be tested and isolate as well. They were all good at preventing further outbreaks, but the weaknesses of that were the implementation and adherence to public health measures varied wildly across countries and communities. So everything wasn't the same. And there were inconsistent outcomes. Enforcement of measures have been challenging, to try and force people. I mean, I know that, there were instances on the news about people breaking the social distancing laws, but then it was about what you have to do. How do you treat people when they do break these laws? And compliance fatigue, the people who were actually administering, the vaccines and what they actually saw whilst working in hospitals led to burnout in a lot of cases. The healthcare staff were so tired, physically and mentally from what they've seen and had to do. And they led to resistance and non-compliance in some areas because they were too tired to do anything. So they stopped in some cases. And then if people were queuing up for a vaccine and they saw a big queue, they used to think, I'll come back another day. And they didn't bother going back. Now, the vaccine development and deployment. Now, the strengths of this, the rapid development and approval of COVID-19 vaccines was a significant scientific achievement. Normally, the vaccines have to be around for a few years and tested and tested and tested before they're actually administered to the public. But with COVID-19, they had to put something in place so quickly because so many people were affected. And it was a huge scientific achievement. The vaccination campaigns were launched globally with millions of doses administered today. And even now, people are still being vaccinated against COVID-19, but they usually have it alongside the flu vaccination in winter. Vaccines have proven to be highly effective in reducing severe illness, hospitalizations, and death. Because at the time, if people, like they contracted COVID-19, some people had a light dose and they were able to, just isolate for a few days or a few weeks and they were okay. They didn't really feel any after effects. But some people, they were in hospital for weeks and months after because it really affected their health. Now, the weakness of this, the vaccine distribution faced logistical challenges, including the supply chain distributions, storage requirements, because the vaccines had to be kept at certain temperatures. So if they didn't have access to the storage for that, then they weren't able to distribute it. The vaccine hesitancy, again, was a huge weakness. People not sure if they wanted the vaccine or being scared to take the vaccine, so not having the vaccine. So unequal access to vaccines has exacerbated disparities between high and low income countries, raising concerns about vaccine nationalism and global health equity. So although everything was in place for it and it was a good strategy, not everybody was able to access it, or they were scared to access it in some cases. Now, healthcare capacity and resilience. The strengths of this were the systems demonstrated resilience and adaptability in responding to the pandemic. They mobilised resources and expanded capacity, implementing innovative solutions to meet evolving needs. So everything was really good. Everything was working and changing, especially when people's needs were being met. Healthcare workers showed remarkable dedication and professionalism in providing care under really, really challenging circumstances. I know that here they used to stand outside and clap for the NHS at one time. The weaknesses of this were that healthcare systems were strained by the surge in COVID-19 cases. There were so many that hospitals were overwhelmed, and there was a shortage of medical supplies, and even the PPE, the personal protective clothing that people used to wear. There was a shortage of that as well. And burnout amongst frontline workers, the staff were so stressed out, and they were working to such capacity that a lot of them were really, really burnt out. Inadequate investment in healthcare infrastructure didn't help. Hospitals not having the services that they should have had, and people being prepared to expose vulnerabilities in different countries, highlighting the need for long-term investment in pandemic preparedness and response for the future. And like I said before, it's like the countries were not prepared. The world was not prepared for a pandemic. It just wasn't prepared. But now they're going to put things in place, and they've already put things in place to make sure if anything does happen on that scale again, then they won't be as slow to respond. My conclusion to that is overall, the response to the COVID-19 pandemic has both strengths and weaknesses. While significant progress has been made in controlling the spread of the virus and vaccines being developed and mitigating the impact on healthcare systems, there are still challenges remaining in addressing the disparities in vaccine distribution. The need to overcome vaccine hesitancy is still there, and building resilience against future pandemics. But moving forward, it's essential to learn from the successes and shortcomings of the COVID-19 responses in order to strengthen global health systems, enhance the coordination, collaboration of the different agencies to work together, and prioritise health equality and social justice in public health interventions. Are you still with me?
Yeah.
Yes. Yeah.
Yeah. Okay, good. Now then, this is, for your assignment, this is looking at your distinction and what you need to cover in order to gain a distinction. And this is about assessing the benefits and issues relating to large-scale vaccination programmes. So when we look at this, large-scale vaccination programmes play a critical role in preventing the spread of infectious diseases and protecting public health. Let's assess the benefits and issues associated with these kind of programmes. So we look at the benefits. The benefits, disease prevention. So people get vaccinated in order to stop them getting a disease. They're highly effective in preventing the spread of infectious diseases, reducing the morbidity and mortality rates, and achieving herd immunity within communities. So to prevent the disease from happening, it's really important to have vaccination programs in place. The benefits are to eradicate and control as well, because the vaccination has led to the eradication of diseases such as smallpox and the near eradication of polio. And I'm sure that there are other diseases that they're working towards eliminating as well. And these demonstrate the potential for vaccination programs to control and eliminate infectious diseases, which on a global scale is huge. It's huge. The public health impact is that the vaccination programs have significant public health benefits. So they reduce healthcare costs. So although it's expensive to roll out the vaccines, when you look at the healthcare costs, if people catch the diseases, they far outweigh the cost of actually, providing the vaccines in the first place. So overall, they would reduce the healthcare costs. They prevent outbreaks of diseases and improve overall population health and well-being. So the population, by having vaccines, is much healthier. There are social and economic benefits. So by preventing illness and disability, vaccination programs contribute to economic productivity. People are more likely to still be working. People go out to work. People are making money and they're spending money. Societal stability. People in society are more stable because they're healthier. And the quality of life is improved for peoples and community, for individuals and communities. So there are benefits from the public health side and also the social and economic side. The equality in access. The large-scale vaccination programs promote equality in healthcare by providing access to preventative services for everybody, regardless of their socio-economic status, their geographic location, and all other factors. So it's important that people from everywhere get access to the vaccines. It's so important that they're put out for everybody. Sorry, I've just jumped. Vaccine hesitancy. Now, these are the issues. When people are hesitant about getting their vaccines, this is usually fueled by misinformation. And that's that thing as well about people being isolated or people listening to people who are giving information, but they don't really know what's going on either. And lots of things can be spread. Lots of information can be spread amongst communities, especially when people are not sure or they're not aware of things. And their health literacy is very poor. People distrust authorities, so it's like the government are telling me that I need to have a vaccine, but I don't want to listen to what the government's telling me to do. I don't trust the government. And people were concerned about the vaccine safety, especially with it being issued so quickly. It hadn't been tested. They all posed a significant challenge to large-scale vaccination programs. And especially at first, there were lower uptakes on people getting the vaccine. So people were more vulnerable to outbreaks of COVID because they weren't quick to respond to get the vaccine themselves. The logistical challenges, they played a big part. Large-scale vaccination programs require robust logistical planning and infrastructure, including being able to distribute the vaccines, the storage of the vaccine, especially when it had to be kept at a certain temperature, and how it was administered, which can be complex and resource intensive, particularly when people have got low resources and especially during an emergency. And don't forget, the pandemic was such an emergency worldwide. Access barriers, the socioeconomic disparities and the geographic remoteness, those were barriers. And cultural barriers. These can all create access barriers to vaccination services. So it's unequal for people to get their vaccine. The coverage of the country, you know, in the area, you know, it's just not what it should be, leaving vulnerable populations still at risk of catching those preventable diseases. So although they're there, it's about people being able to access them is not as easy as at first thought. And especially across America, with it being such a huge area and communities being spread out. And there's so many different cultures in America. And if people were already, you know, like hesitant to get the vaccine, that didn't help either. The other side of that as well is socio-economic disparity. It's like if people had to travel for distances in order to get the vaccine, they might not be able to afford, you know, like to get there. Adverse events. While vaccines are generally safe and well tolerated, rare adverse events can occur, leading to concerns about vaccine safety and undermining public confidence in vaccine programs. I mean, they usually say that 1 in 1,000 or 2 in 1,000 can be affected adversely by you know, taking a paracetamol, taking a tablet. And with the vaccine being so new, people were worried about, oh, it's going to kill me, or, you know, I might catch different diseases, it might not be safe. The vaccine equality, the global disparities in vaccine access and distribution, really exacerbated by the vaccine nationalism, intellectual property rights, and supply chain issues, highlighted the need for greater international cooperation and solidarity to ensure equal access to vaccines for all the different populations. There was such a disparity in people being able to get to the vaccine and how it was distributed. So in conclusion, the large-scale vaccination programs do offer significant benefits in preventing and controlling infectious diseases, promoting public health and achieving health equality. Now, it's really important that you remember that when you're doing your assignment. However, they also face challenges related to vaccine hesitancy, logistical complexes. Don't forget about how they're actually going to administer the vaccine. The access barriers for people to actually get access to the vaccine, and the safety concerns. Is it safe? Is the vaccine safe with it being so new? And the global disparities in vaccine access. Addressing these issues requires a multifaceted strategy, including improving education and communication campaigns. They need to strengthen healthcare infrastructure, you know, like put more things in place for the hospitals and for the actual services people get in order for them to get healthier. So the healthcare infrastructure needs to improve a lot. The delivery systems for the vaccine needs to be improved. And addressing inequalities in the access and promoting international collaboration and solidarity in vaccine distribution efforts. So the way it was actually, you know, distributed and the way people collaborated all needed to be done better. By addressing these challenges, vaccination programs can continue to play a vital role in protecting people and community health and contributing to global health security challenges. There are ongoing challenges to health, but at the moment, that pandemic is over. So when you're coming to do your assignment, make sure that you do a lot to do with the COVID-19 and how it was administered. And there we have, it concludes today's lesson. There we have some references at the end there for you to look at, to gain more information. And you can also find lots more videos on YouTube. Is there any questions from today?
I think I'm okay. And maybe when I go through the class again now, I'll be okay.
Yeah, everything will be put on Moodle anyway. You know, the slides will be all on Moodle.
Yes.
Everything
When
will be
it's
put on
given on
Moodle.
Moodle, I'll go
Yeah.
through it. Yeah.
Right,
Thank
okay.
you.
And don't forget to watch the other video on the health promotion as well.
Okay. Okay.
Okay.
All right, lovely to speak to you both. Enjoy the rest of your day.
Thank
All right.
you.
Okay.
See you
Thank you.
soon.
Bye
Bye.
for now. Bye.
All right. Bye.
Bye.